Wellness Friday with Sakra World Hospital.
It's a brand new episode of Wellness Fridays in association with Sakra World Hospital. For those of you who tuned in last week, it's the familiar voice of Dr. Alok Mohan Uppar, consultant neurosurgery at Sakra. If you've tuned in fresh, let me tell you, he's one of the major people in sacral neuromodulation. That is his area of specialty. Hi, Doc. Thank you for joining us again this week. How are you?
I'm doing good, Rishi. How are you?
Excellent. Just a recap. The simple procedure for sacral neuromodulation, you had said it's not a major surgery. Talk about that again, please, before we proceed.
Yeah, it is not a major surgery in terms of it doesn't require any general anesthesia or spinal anesthesia, or it does not involve any complicated steps in the surgery, or it does not involve any life-threatening complications which are seen with most neurosurgical procedures. So that way it's not a major surgery. It is a very minimally invasive procedure. The patient is actually awake during the testing phase of the surgery. So we also call it as a trial of sacral neuromodulation, the testing phase. So in this procedure, the patient is actually awake. They lie on their tummy, and we just try to do small injections by which we will be able to reach the sacral nerves, but in particular the S3 nerve. And then once we are satisfied with the kind of results which we get on electrical stimulation, we just put a temporary battery and see how the patient does for a good 5 to 7 days. If the patients are happy with the results, if they feel that their bowel or bladder complaints are solved to a great extent, then we just place the battery, which is another small procedure. So basically, it's a simple procedure. It's a non-complicated procedure.
Is the device implanted personally? Suppose, you find an ideal candidate and you put in that battery. Does that battery have to be changed or is it permanent?
Okay, so as of now, what devices we have, these batteries, they last for a good 10 years at least, because if you get good stimulation at low dose current, we have candidates in whom this device can last up to 15 years also. So in case they run out of battery in the next 10 to 15 years after they get a good result, the procedure is again very simple. You just have to open the small incision that we would have made on the buttocks to place this battery. So they just go for a battery replacement, that's all. That's going to happen only after 10 to 15 years, not before that.
That's heartening to know. When we come back, Dr. Alok Mohan Uppar is going to talk about what kind of improvement patients can realistically expect. This is Wellness Fridays with Sakra World Hospital. To learn more, check out the Sakra mobile app or head over to sakraworldhospital.com. I'm Rishi K. Stay with us on 94.3 Radio 1.